Hey there, everyone. It's Dale Hall, Managing Director of Research at the Society of Actuaries. One of the important things that have come about in the COVID environment is how people are planning for retirement, and especially how people who are aging are thinking about the types of housing and the type of support choices they might want to consider with COVID and the pandemic in mind. So today I'll be discussing an important SOA research report that we put out, the impact of COVID-19 on senior housing and support choices. Steve, thanks for joining us today on the video. It's an important issue that I know your aging and retirement group at the SOA has been emphasizing and studying the importance of how seniors are looking at housing and support choices. What's some introductory information you might want to give us about all that's contained in this report?
Thanks, Dale. So this report, it's one of a series of efforts that we've done related to the impact of COVID on retirement risks. And our Aging and Retirement Strategic Research Program has really made it a big priority to examine COVID as it relates to aging and retirement issues. And we've been really fortunate to have such a great group of volunteers thinking about these issues. And they've really made this work so impactful. And I know myself, and we're all just really so appreciative. And so, as you said, Dale, the report deals with the impact of COVID on senior housing and the decisions that retirees and their families need to make. And we published the report back in April. And it was one of the first things that we tackled as part of our COVID work. And it probably goes without saying that this is continuing to be a very relevant topic, of course, with COVID. It's still so much at the forefront of everything. You just open up the newspaper today.
It's a really important report. And for those of you who want the directions to get there, simply go to the SOA website, click on research. And then if you see our COVID-19 listing, it's all listed there among all the different things the SOA has been doing, and a really important focus on this aging and retirement issue. Steve, the genesis of this has a lot of helpful actuarial volunteers and people who work in the aging and retirement community, both inside and outside or parallel to the actuarial profession. So I wonder if you could just give a background on how this all got started, how the conversations occurred to build this report.
Great, thanks, Dale. So as I said, the impact of COVID, it's been a high priority for the Aging and Retirement Program, and we wanted to explore it in a lot of different ways. And so Anna Rappaport, who chairs our Committee on Post-Retirement Needs and Risks, and also chaired our Aging and Retirement Program, started an online conversation on a listserv that we have that has about 500 experts on it. And so very often we reach out to this listserv to get feedback and share information. And Anna, who's just an amazing, amazing volunteer, former president of the SOA, was really instrumental in building up this listserv over the years through lots of networking that she's done. And so the nice thing about this listserv is that it has a really wide range of professionals who deal with retirement. So not only actuaries, but we have economists, attorneys, and financial advisors, and just a lot of other people with different backgrounds. And most of them are in North America, but we also have people from all around the world. And so we really get a lot of different perspectives. And so during this conversation, around 10 major topics came up. Things like how COVID will impact employers and retirement plans, what new family dynamics might happen, like more multi-generational housing, and the need we would expect for more work in retirement because of job losses since COVID. We hear about that every day. And so starting with this, I worked with Anna on an initial report that summarized these major topics, these 10 topics. And then we decided to turn it into a report series that would do a more in-depth focus on a few of these topics that came up. And so that's how we came to write this one on senior housing options, because it was one of the major topics, and again, clearly really, really relevant right now.
No, it's a good point to make. Many of us, and probably I'm guilty of this as well, simply think of retirement as, a number. Let's accumulate personal assets. Let's save for retirement. Let's think about turning that into lifetime income. Maybe a very macro view. We don't always think about some of the day-to-day details that are involved in actually living in retirement. So I think it's really important to draw out. Maybe you can give some insights as why housing and even support for people in retirement and the decisions you make are just as an important part of retirement planning.
Yeah. Well, there are a number of reasons why it's so important. So if you start where you live, it's really a fundamental part of retirement planning, and it's very closely tied with managing your physical needs over time. And so clearly expense is also a big issue. It's the greatest expense for most older people. And it's also for a lot of middle income people, their biggest asset. And so when you look at it personally, where you live is also really important because it defines how you get around and how easy it is to shop and how close you are to your family and friends. And so, I think a real key here is that how well you function in any type of home, and this goes all the way up to including nursing home, living in a nursing home. It's really going to depend on what happens with your physical and cognitive abilities as you get older. And so you might be able to modify where you're currently living to make it more accessible and easy to live in, or you might need to make a difficult choice to move into a situation with more support. And that support, it could either be formally or informal. And the prospect of needing that support should really be a part of your long-term thinking about retirement and housing.
Steve, the report also goes through, this variety of senior housing options that are available. The list is longer than I would have realized. What are some of the things that are covered in the report?
Yeah, so that's a good point. There's really a range of options. And in the paper, we talked about four major categories. So if you start on a scale of having the least needs and then going to the most, you would start with active senior communities. And that's housing that's typically limited to residents who are 55 and older. And it would also have a variety of activities for the residents. And then next, going up on the scale, there's independent living, which can provide some help for residents who aren't able to function completely in their homes. And it might also have things like communal dining, exercise programs, and transportation for shopping. And then you go up further on the scale next to assisted living, which offers some help with activities of daily living. And usually there's an option for meals. And for medical care, there may be a nurse or other kind of health professional on site for that service. And then, but hardcore skilled nursing care is usually not part of an assisted living facility. And then finally, you get to kind of the top level, which is in a nursing home, where you can get skilled nursing care and really extensive assistance. All your meals are provided. And then you might be either there for the long term, because you have a long-term need, or you might just be there temporarily while you're rehabilitating for some kind of health issue or event.
And then we layer COVID-19 onto this, or just a pandemic in general, which brings its own challenges. Well, what are the types of challenges does COVID-19 create for senior housing, or how to support a resident? Maybe even family member choices, and probably also for the facility itself.
So here, I mean, COVID has had such a huge impact on senior housing. So on those four categories I mentioned of housing, anywhere that you have communal living and where people do joint activities, COVID can just spread like wildfire. It's bad. So, all these senior housing facilities have had to stop communal events, things like group exercise, and clearly these type of restrictions can be difficult on the physical and really the mental health of the residents. And so, turning to families, the impact on families is just so tragic. Many family members weren't and haven't been able to visit. And I'm sure that everyone's read stories about relatives dying alone in nursing homes because no outsiders were allowed in, lots of restrictions. And it's, as you mentioned, it's also been really difficult on the facilities having to impose these restrictions and dealing not only with the residents, but actually their workers who may have brought in COVID. They might be working at different facilities besides the individual facility. And so it's just been really terrible for so many people. And I think the bottom line is, if you looking down the road, because of COVID, we think people will want to do anything they can to stay in their homes. And we expect there'll be companies looking to develop and sell innovative solutions to help with that.
Yeah, I really agree. I mean, the impact of not only this pandemic, but also potential future pandemics will certainly change the perspective of how we evaluate all the advantages and disadvantages of senior housing choices. Infectious diseases have been around for a long time. Obviously, they've always been a risk, but these pandemics get it to be this more extreme risk to residents of senior communities. And as a result, as you're noting, people will need to rethink what are their preferred choices, and others may actually leave what their current arrangements are to seek other options. So I'm interested, and it's important how this report has kind of signaled the importance of reevaluating the best ways to plan and manage that type of retirement risk. The COVID-19 situation is rapidly evolving. Vaccines will ultimately become part of the equation here too. It's good to know that the aging and retirement group is closely monitoring this and providing a lot of helpful information and good research communications that can further explore the impact of the pandemic. Thanks for everyone for watching in. I hope you find this video helpful. I encourage you to go look at this report and all the related reports on COVID-19 and on aging and retirement that we've put out. You can also check in and listen to many of these same topics on our Research Insights podcast. Just dial into your preferred podcast player and subscribe there. And we always appreciate your feedback. If there's something that drives a comment or a thought, send us an email to us at research@soa.org. Great to get all your feedback on your research work.